I think you moved down there, Dan.
Oh, okay.
You did. You're next to Larry. You got to
they switched
keep
us
Inman in
around.
line down there. We've lost our administrator. Where?
Well, where is he?
Yeah, sure.
Do you want some help? I can.
There he is.
There he is.
Where's the
Our
suit?
administrator. All right.
Mr. G, I want you to do that. I got this switch here.
I will call the June 5th Public Health and Safety meeting to order. Please rise and join me with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Again.
Roll call, please. Jackie.
Commissioner Wheelock?
Yes, ma'am.
Thomas?
Yep.
Rennie?
Here.
Lemcool?
Here.
Lathrop?
Almost here.
Inman?
Here.
Chairman Maxbauer?
Here. All right. First on the agenda is approval of our May 1st minutes.
Madam Chairman, I'd move to approve the minutes as distributed.
Moved by Wheelock, seconded by Rennie. Discussion? All those in favor say aye. Aye. Opposed, same. Motion carries. This is our first opportunity for public comment. Please come forward, state your name and address, and comment to the board. Jackie, do you want to read it again?
Thank you.
I think everybody remembers.
We don't need to. Everybody remembers. Let's go.
Good evening. I'm Marcia Smith. I live at 529 Washington Street. I'm here representing my role in the Grand Vision public input process. I was also chair of the Grand Vision Core Committee. And I want to address just a couple key points, and I'll keep my remarks brief. It was mentioned in the previous meeting that the folks in the audience were not representative of the citizens of our county. It was a small handful. I do want to remind you that we have gotten the input, not on this specific issue of the Hartman-Hammond Cass Road Bridge, but we have gotten a lot of public input. We used a lot of public dollars to get a lot of public input. And in 2008, during that public input process called the Grand Vision, citizens told us that repairing and improving existing roads should be the top priority for investment of our public transportation funds. That was the citizens, the 12,000 citizens that showed up. We conducted an independent, scientifically conducted random sample poll at that time through the Northwestern Michigan College Research Department. At that time, 86% of the people surveyed, and that's only got a little 5% fluctuation there in terms of off, so we can be pretty confident that reflected the opinions of folks in 2009, that they thought the same thing. The best investment, the primary investment, the priority of our public monies should be on replacement and improvement of existing roads. 6 months ago, in 2012, the exact same question was posed again to a random sample public opinion poll conducted by NMC, and the results was exactly the same. 86% of the people said repair and replace existing roads before you build new ones. I use this to support the public case that this is not an either-or, that the Cass Road Bridge should be replaced, and then we should enter into a different kind of discussion about an east-west corridor. I implore you to learn what we have learned from previous experience, and that is only through an open and transparent public process should these kinds of decisions, major decisions about investment of our public dollars, be made. We learned from citizen participation through the Boardman River process and through the Grand Vision process. It would be a travesty not to study this issue further, not to get further public input. At the same time, I believe it's a travesty to deny $3 million in designated funds for a bridge that could almost be built, close off that key corridor, that key local corridor. So I think it's not an either or. I know you've heard that before, but I want to give you the citizen input on this. I will also enter this into the public record. Thank you.
Thank you, Marcia.
Thank you so much.
Jason.
I hadn't planned on speaking.
I'm sorry.
In the spirit of open and transparency, just so people understand, the Grand Vision process involved less than 6% of the entire population of the area that it covers. Not everybody agrees with that, but eventually people wear out and they don't disagree. It's called consensus. Now, I want you to take that into account when making public policy decisions based on what the Grand Vision folks are suggesting is their priorities. Just a little background, more recent meetings, they had some meetings in Benzie County, Grand Traverse County, Kalkaska, and Antrim, I believe. Benzie County, there were about 2 citizens at that meeting, 18 members of the Northwest Michigan Council of Government, and there were about 12 picketers outside. It was similar in Kalkaska, although they didn't have the picketers. The Grand Traverse County, of course, there are quite a few more people who are involved directly with the Grand Vision. It was much busier, but it had to be extended because there were so many people who wanted to have their comments heard. They limited them to 3 minutes, and they had, of course, all the people singing the praises of the Grand Vision projects. So, in the spirit of open and transparent, government policy making, what have you, if you're going to act on the Grand Vision, then make sure at least you understand it does not represent any kind of majority in this community. Thank you.
Jason, in the spirit of transparency, would you give your name and address
I'm sorry,
for
Jason-
Jackie so she can have it for the
Jason
record?
Gilman, East Bay Township.
Thank you. June.
June Thaden, 520 Highland Park Drive, Traverse City. I've got a show and tell here. I was a librarian and I like show and tell. Road Commission map of Grand Traverse. The bright yellow line is Cass. Just beyond the bridge that is in dispute, but it shouldn't be. We have the money, let's do it. Are the playing fields, our routes to River and Beitner. You need to replace that road. You really do. You've got the money, don't waste it. And this debate is not about the Grand Vision, it's about a road, a bridge we need.
Thank you, June. Andy?
Thank you. I'm Andy Knott. I live at 1662 Melody Lane in Interlaken, but I'm here representing the Watershed Center, Grand Traverse Bay. At the previous meeting, it was mentioned that in 2011, the Road Commission adopted a resolution supporting the replacement of the Cass Road Bridge. Based upon that, the former Road Commission manager, Mary Gillis, went out and did what you might expect, got the grant for $3 million. Since then, the new County Road Commissioner, Jim Cook, and his staff, and the staff at Conservation Resource Alliance have done a great work in terms of working with MDOT on flexibility for that $3 million grant to make it last longer so that we can actually have this happen when the dams come out. And more importantly, MDOT is saying that they will make that grant all state money, which means it can be used as a non-federal match for the overall dam removal project for all the rest of the 3 dams. So essentially, the Corps of Engineers, for their involvement, requires a 35% match. And that would be for Boardman removal, Sabin removal, replacement of the bridge, and modifying Union Street. So if you give up that $3 million, there's still a big chunk of match that locally we would have to find. It would cost the county and the city even more to go ahead with these projects. So that's one fiscal thing that you need to think about. The other thing is this was mentioned earlier, but the environmental review process, it will all be done into summer, early fall for the dam removal and the bridge project at Cass Road. The Corps of Engineers is handling that. If you abandon that part for Cass Road and go with Hammond Hartman, we all know what happened last time in terms of the environmental review. So you'd be giving up that and having another big process ahead of you that would be very controversial. Just 2 other quick things. There was a question about when the bridge might be built and how long it might take. There's actually been discussion on the IT and with the engineers about building the replacement bridge before the dam comes out. So obviously you'd have to close Cass Road, while that's being built. How long does it take to build a bridge? Usually, a few months, it's not years. And then you'd have to close it again when you're tearing out the old crossing. But it could actually be built before, and it may have to be built to use the money by the deadline it has to be used by. And then lastly, the idea of removing Sabin First has a lot of concern environmentally in terms of sediment transport. But again, if you delay replacing the bridge, you'll lose the $3 million.
All right.
Thank you.
Anyone else?
I'm Kimberlee Bjerke. I live at 3234 Hunters Ridge Drive. I'm also a project manager for the Conservation Resource Alliance, and we're a consultant to the implementation team. I just wanted to clarify a couple things in the last meeting. I heard someone mention that CRA had applied for that MDOT grant for the replacement of Cass Road Bridge, and that's not true. The Road Commission applied for that $3 million grant from MDOT for Cass Road Bridge replacement, I believe, back in 2011, perhaps. And the grant was awarded to them, not CRA. So it's up to them to decide whether to spend it or not. And I also heard Carl Brown mention a 30-day time frame request for deciding whether to do this bridge or not. I think there was maybe a little miscommunication between myself and Jim Cook the last couple days. I was trying to provide him with some information about the IT's timeline in the short term for removing Boardman and Sabin dams. And where the IT is at right now is that we're in the final stages of selecting our engineering firm for the next phase of dam removal. We're hoping to have that engineering firm selected by the end of June. Once that happens, we work with that engineering firm to develop a scope of work. Part of developing that scope of work is they will tell us how much things cost. So we will be the three basic things I imagine we'll be talking about is survey work. How much will it cost to survey the Boardman Dam area, Sabin Dam area, and obviously Cass Road Bridge. Our question will be, well, should we survey the new river channel for a new bridge or not? So we need some direction from the bridge owner as to whether we should be talking about that with this engineering firm. Soil borings. I imagine soil borings are going to be more intense, and we're going to need more if we're going to build a new bridge as opposed to just taking the dam out and moving the stream back to its original channel. And of course, design work. It's one thing to design for the removal of a dam and obviously the bridge because it's attached to it. It's another thing to design for the removal of that along with constructing a new bridge. So that 30-day turnaround time frame I think maybe got tweaked a little bit. And again, I was, trying to give an update as to where the IT is at, which the Road Commission is an ex officio member of, in selecting that engineering firm and moving forward. Because we do have some grant funds. We're applying for grant funds all the time to embark on the removal of Boardman Dam and also Sabin Dam. I also provided Dave Benda a list of highlights that alludes to why Boardman Dam needs to happen before Sabin Dam. Structurally, Boardman Dam is compromised more than Sabin Dam is. Boardman Dam is upstream of Sabin Dam. Me as a river person, I like to start upstream and work downstream because everything we do up here affects things down there. The Sabin Dam impoundment it has more sediment in it than Boardman Dam impoundment does. And also the Sabin Dam impoundment can serve as a catch basin. So if we elect to construct the new Cass Road Bridge, any sediment that's potentially released will be caught down in Sabin Dam impoundment. So those were just a few things that I heard in the last meeting that I wanted to clarify on. And we would like to be a part of the next working session that you have with the Road Commission so that more facts can be portrayed and we can pull in the engineering firm for the Army Corps who's done a lot of work on the environmental assessment and put together target timelines and construction sequencing to make the Boardman and Sabin Dam removals happen with or without the Cass Road Bridge replacement. Thank you.
Thank you. Anyone else? All right. Next is approval of the agenda. I am going to ask that we remove action item 9C, 1 and 2, Commission on Aging fund balance recommendation, and outside agency funding. And I would like to add Commission on Aging Board Technology. You have a piece of paper on your desk talking about what the Commission on Aging Board did at their meeting on Tuesday. So I will make that 9C1, Board Technology for Commission on Aging Board.
Madam Chairman, I'll make a motion to approve the agenda with the amendments you have discussed. I'll second.
All right. Discussion. All those in favor say aye.
Aye.
Opposed, same. We have an agenda. Next is our special order of business. And I would ask that our Director of Veterans, Chuck Lurchin, come forward and recognize someone who used to drive me to school when I was young.
Good
You know who
evening.
you are.
Chuck Lurchin, Director of Veterans Affairs, and thank you very much for the opportunity. Just a few minutes for, as the chairman said, just a special recognition. Real briefly, last fall, Mr. Jim Tompkins, who is here today, well known in Traverse City, who's also one of your appointed Veterans Affairs Committee members, him and his wife Ida stepped forward and recognized a need that the Veterans Affairs Department had been experiencing for quite a number of years. For about 3 years, we were in dire need of some specialized veterans processing, claims processing software that, due to budget constraints, whatever, we were unable to get it. It was quite pricey to get it. Out of the blue, Jim Tompkins came into my office one day and he said, "I'm tired of waiting. Our veterans need this. They're waiting too long to get their claims processed. This will help." Our office was getting further and further behind the rest of the country in being able to essentially file things electronically. That's the way of the world. Paperless, no more files, that type of thing. And he said, "How much does it cost?" And I said, "Well, we can't get the money from the board, Jim, you know that." And he said, no, we want to purchase this for you. And it was quite pricey, in excess of $7,000 total. And last December, I brought their donation to the board for acceptance, and we were able to purchase that software along with some computer hardware. We now have that up and running in the office. It's been of tremendous value to us. And we wanted to get it up and running relatively quickly, and we didn't have the opportunity to do what I'd like to do tonight, which is properly recognize some outstanding citizens, to recognize a need, whip open their checkbooks out of the goodness of their heart, and help truly so many people. We'll never know how many people this helped along the way, not the least of which is myself and my staff, making our job so much easier. And so what I'd like to do this evening is ask the chairman of the Veterans Affairs Committee, Jim Wagner, to step forward, and maybe Jim and Ida, if they would. And with them tonight also is their daughter, Mary Ann, and her husband, George. And we just have a very small token of the Board of Commissioners and my office's gesture of gratitude and recognition and appreciation for everything that they did for us. So, Jim?
You know, before I forget, I think the county board deserves, of course, a lot of credit for having provided Chuck and his staff with an additional full-time person at a time when that is not a small order financially. So a lot of credit deserves the board, and maybe they can give their Chuck there.
And, you know, Jason, as long as you have your camera, I've known this family since I could crawl. I would like to have you snap one with me. And Mary Ann, too.
go. Yep.
There you go.
George is my son-in-law, and also my protector.
Yes. One more. There we go. Excellent. Thank you very much.
All right. Next, Area Agency on Aging Annual Report.
Right.
Bob, please come forward and introduce yourself.
Hi. I'm Bob Schluter. I'm the director of the Area Agency on Aging of Northwest Michigan. Did the annual plan get to
Yes.
everybody here? You all have a copy of that?
Yes.
Because I had extras if you didn't.
It is here.
You may have questions on that. I also, Commissioner Max Bauer has been appointed to our Board of
I'll be
Directors.
there tomorrow, my first meeting.
Thank you. That would be great.
Canceled January, remember?
I know. We had some weather going on. And I want to thank other commissioners here, all of you, for the support for the area agency over the years, and your involvement with both the County Commission on Aging and also our regional organization. I'm not going to take a lot of time. I do want to cover some things that we're really fired up about, but I also want to start with, along with a lot of other organizations, we are going through some tough times with funding and cuts with the sequestration and other things, and you're going to hear, I'm sure, that a lot. We're doing okay, but as the years progress, and if they don't get it fixed, it's going to get a lot rougher. This year we covered internally $70,000 in cuts. We're preparing for another $130,000 October 1, and then 5% after that for every year roughly. And that I use roughly because that's one of the difficulties we've had this year, is getting firm numbers and figures from our state and federal people. So, but everybody's working hard on it. Now, the things we're really excited about is, yesterday I was on the Capitol, the front yard of the Capitol with 800 seniors.
Bob, would you try the other mic? They're telling me that the one you're using is not picking you up.
Or just lean in further.
Oh, lean in, I
Yeah.
guess.
How's this?
There you go.
Thank you.
Perfect, I think that's good.
Did you want me to start over?
No.
We had 800 seniors, and we do it every year. We've done it every year for, well, the last 8 years. The governor, the first time ever the first time in the last 20 years, the governor spoke, and he's been quite a friend to the seniors for the most part. The platform that we were discussing and that we're carrying forward in our 10 county, the three main items are elder care, home and community-based care, elder abuse, home and community-based care, and then also specialized training for caregivers. The whole trend towards working with our aging population is to help them stay at home as long as possible. And to do that, we need to be smart about it, and we need to have professional training. And we have hooked up with 3 caregiver training programs, one with the Michigan State University School of Medicine. And what they do is we work with the individuals, either from private companies or individuals taking care of family members, and help them learn the techniques and adequate caregiving. What does this do in the long run? It keeps people at home where they want to be for as long as possible before they have to move into a different long-term care setting. We have wonderful long-term care settings in our region, but most people would like to stay at home as long as possible, and there is quite a cost savings when that can take place. There's also, I like to refer to stepping stones. We create stepping stones to end-of-life care, and we're getting a lot smarter at doing that. I skipped right by it. I wanted to say that I think our relationship with the County Commission on Aging has never been better. I hope all of you feel that way too. I know Georgia is active in one of the programs I want to talk about right now, the Aging and Disability Resource of Northwest Michigan, which is really a long-term care 211. We're going to be tying in within the 10 counties with our 211 systems as things come online. But it is easy access for individuals who need long-term care information, and it takes everybody who touches an older person or a disabled person to be involved in it. Everybody needs to know what everybody else is doing so that we don't send people on wild goose chases to find services. We are in baby steps with that, and we've just started, but we are coming online this fall. Online means we're a website, a state-supported website. They are working on a 1-800 line that will be geo-routed, meaning somebody calls and the right number, it'll come directly to our resources up here. And the big goal is to, like I mentioned, is that people don't run all over the place looking for services. One of the training programs that I did want to mention specifically is it's called Better Training and Better Quality. That's the one that we've tied in with the Michigan State School of Medicine. It is working with our private for-profit and nonprofit home care providers. And what we're trying to do is to help their workers raise their level of expertise. It's a certification program. It's based on a rigid program that was written by researchers down at the School of Medicine, and it's working. And what we're finding out is that it's dealing with stress levels, it's dealing with nutrition, it's dealing with making beds for bed sores, all kinds of things. And it also helps out the private provider, either the company or the family, because they now will have a more highly qualified individual. I think that, I'm glad that's it in a nutshell, our activity right now. I'd be glad to answer any questions related to any of the plan that you've been looking at. Like I said, we're looking at about a 5 to 6% reduction until they get the sequestration stuff sorted out, and we're hoping that will come soon.
All right, any questions for Bob? Herb?
Bob, how are you going to combine your 211 with the program that Grand Traverse County and the 5-county area, actually the state of Michigan has with 211?
Yeah.
And then the other question I have is how you're going to work with the PACE program that the Pavilions is looking at.
Well, the first question is, and it's a good one, we're not, and we don't pretend to be the 211. We're hoping that when this Aging and Disability Resource Collaborative gets together, it will be a layer under 211. Somebody calls 211, and that person receiving that call talks about long-term care, grandma needs help. That 211 person zips it off. So yeah, we're working with a partner, and I really see it as a layer underneath. I have talked to Pavilion several times about the PACE program, and the state of Michigan has actually allocated $15 additional million towards that initiative this year. I haven't heard, they visited some places, some PACE programs downstate this last week, and I haven't heard back from
Ralph. Well, Ralph was in the audience, and he come back rather convinced, I would say, and very excited about a PACE program up here.
Yeah, we actually, I researched it about 4 or 5 years ago quite extensively, and decided we didn't have the resources at the time to do it, because you really need several $1 million in the bank, and you need a lot of community behind you. Now, we could get the community behind us, and eventually we could have gotten the resources, but it really wasn't the key part of our mission at the time. But as I have talked to Corey and one of the board members there at the Pavilions, and we have said we will play wherever you want us. We're excited about it. I'm all for it. It's a real, we're huge advocates for it. So.
Any other
More
questions?
to come on the PACE program for the commissioners.
Any other questions for Bob? All right.
Thanks for coming.
Thank you.
Thank you. See you tomorrow.
Yes, you will. All right. We are done with special orders of business. Next, the consent calendar. Jackie.
The purpose of the consent calendar is to expedite business by grouping non-controversial items together to be dealt with by one commission motion without discussion. Any member of the commission, staff, or the public may ask that any item on the consent calendar be removed therefrom and placed elsewhere on the agenda for full discussion. Such requests will be automatically respected. If any item is not removed from the consent calendar, the action noted, receive and file or approval, is approved by a single commission action adopting the consent calendar. A, receive and file. 1, Community Corrections Monthly Report for April 2013. 2, Grand Traverse County Commission on Aging Monthly Report and non-action items. B, approval. 1, resolution to change 911 plan for dispatch. 2, Mitchell and McCormick Annual Maintenance and Support Agreement renewal for health. 3, surplus vehicle for Grand Traverse County Sheriff's Office.
Would any member of the public like any item on the consent calendar removed? Any member of the commission, staff?
Madam Chairman, I'll make a motion to approve the consent calendar as presented.
Support.
Moved by Commissioner Inman, supported by Commissioner Wheelock, to approve the consent calendar. Discussion? All those in favor
Yep,
say...
roll call
I'm
vote.
sorry, roll call. Thank you.
Commissioner Thomas?
Yep.
Rennie?
Yes.
Lemkool?
Yes.
Lathrop?
Yes.
Inman?
Yes.
Wheelock?
Yes, ma'am.
Chairman Maxbauer?
Yes. We have no items removed from the consent calendar. Department action items is next. Northern Lakes Community Mental Health.
I'll try this microphone, see if it works, right?
All right, just sit close.
Just that close. So my name is Greg Paffaus. I'm the CEO at Northern Lakes Community Mental Health, and I'm joined by...
I'm Nicole Miller, one of your appointees to our board.
So we're pleased to be here, and as always, when I come to these meetings, I'm a little awed by the agenda that you deal with and the types of issues that you have to deal with to do your job within the county. I was a little worried that everyone was here because we were here, so I was thinking, how did this happen?
It was a nice feeling when you stood up and everyone left the room.
That's right.
Okay, I got you.
I did take it personally. Actually, was a little relieved when that happened. So, but in your packet, we're just going to talk briefly about items, I assume it's by page 32 through 46. And there's really no specific action that we're asking for you. This is an informational update. I also want to thank you for the unbelievably high-quality persons you appoint to the Northern Lakes CMH Board. This has been a difficult year for Northern Lakes and a difficult year for me personally. There's been some unique challenges that we've had to deal with. And we've had remarkable board leadership. Melissa Fournier has been our board chair. She resigned recently for some personal reasons. But her leadership and passion and vision have been unbelievably valuable in helping us navigate some pretty difficult waters. Commissioner Henschel was a tremendous addition to our board. And Frank Tassiello, for those of you who knew Frank Tassiello, served on our board for a long time. And if I could become halfway as bright and capable as he is at 93, I would be shocked. It is remarkable what he brings to the table. We also appreciate the great new board members that you have appointed to our board, Mr. Rennie and Mary and Jerry. They come to our board at a time, again, of trying to move out of some of those challenges, and they have not been fazed by that issue. I think they're all challenged by that, but it's been tremendously important. So there are three main documents here. The first one, pages 32 and 33, is simply a reflection of a community needs assessment that we did across 6 counties. So this is not unique to Grand Traverse County. And it included interviews with persons as well as survey and other data collected. And the purpose of this was, without any boundaries placed on the information, what are the 5 top priority areas you would like the community mental health program to look at? And when you look at this issue, some of these are not what you would traditionally see as a public mental health responsibility. But the reality is our system has shifted dramatically from a more traditional medical model to a support model. And when Bob spoke about home and community-based care, that's a lot what public mental health does as well. So you'll see a focus on housing. And we certainly are active participants in issues such as the continuum of care. You see continued access concerns for persons with mild to moderate mental health conditions. There continues to be a significant void within the state of Michigan with that. Individuals who need treatment but don't recognize treatment, how do you engage people that others believe have needs and likely do have needs but are resistant to care. And we've been pleased to be part of a developing homeless group to look at some of the homeless issues unique to the Traverse City population as well. And you see transportation options. I'm sure that always comes up with you guys. And emergency services access. So those are 5 key areas that organizationally we're looking at. The next document is the regional map and the letter that goes with that. We've spoken about this previously. This has continued to move forward. So you'll see a letter dated October 26, 2012 from Linda Zeller. And the subject line is regional map. And that is followed by a nice colored map of the state of Michigan. What this map shows is the new configuration of the prepaid inpatient health plans within the state of Michigan. There are currently 18 PIHPs. Those 18 are all community mental health services programs. So there's 46 CMH programs, 18 of those also function as a PIHP. And a PIHP is a managed care entity. And in this case, it manages the Medicaid behavioral health plan for children with severe emotional disturbances, persons with developmental disabilities, and adults with mental illnesses. Northern Lake CMH is currently one of 18 PIHPs. Through this new regional configuration, which will begin January 1, 2014, there will be 10 PIHPs. Northern Lakes will no longer be a PIHP. You see that the tip of the mitt area, the gray area, brings together 21 northern Michigan counties, 5 community mental health services programs, and a new regional entity becomes created to receive and distribute the Medicaid dollars that will come to those 21 northern Michigan counties. With any such change, there's opportunities and there's some significant risk that go with that. I think the jury becomes how well we implement this change, how well we can save dollars by doing that, how well there's greater quality to accomplish, and how well 5 CMHs work together to ensure better outcomes. With this change, there's also a change that I want to make sure that the commissioners are aware of, that with this integration with these 21 northern Michigan counties, it also brings northern Michigan substance abuse services into this PIHP structure. Currently, NMSAS is a separate organization that manages the substance abuse benefit for persons in 30 counties. There was legislation passed late last calendar year called the Pileski legislation, or Pileski bills, which required between October 1 of 2013 and October 1 of 2014 for those substance abuse coordinating agency functions to become part of the new PIHP structure. So between the present and October of 14, there will be efforts to accomplish that, and we are actively working with NMSAS to do that in a way that provides the best outcome for that, and as NMSAS looks at what its role will be in the future. Those documents are followed by a summary of what's called the application for participation. It's like a request for proposal, and it is a summary of what those 10 new PHPs have to be developing. That was released in February. The initial response was April 1, and the final response is July 1 of this year. The department, based upon the information that is submitted, will determine if those 10 new entities will be approved to be the manager of the Medicaid dollars. Within that document, and certainly for the sake of your time, I'm not going to walk you through this. You can see on the title page, and this should be page 36, you can see the content areas. The new PHP is largely an administrative entity, but I particularly wanted to share with you the 5 public policy initiatives. These are state of Michigan priorities. You'll see they deal with regional crises. You'll see they deal a lot with health and wellness. As we've spoken before, persons with mental illness die on average 25 years younger than people who don't have mental illnesses. So there's a strong effort to really look at integrated health care. One of the things Northern Lakes is doing that we're really excited about, we actually have renovated our Hall Street office to have a primary health practice in our building. And we're doing that contractually with Traverse Health Clinic. And that will actually open up this month, a little later this month, so that people that we serve who have access to primary health care challenges can actually receive primary health care within our building. You'll also see when you look at that, there's a lot of language that looks at the integration of persons with substance use disorders, because many, many of the people we serve have co-occurring disorders. A lot of information in here about Olmstead. Olmstead was a Supreme Court decision that looked at unjustified institutionalization of people who had the right to live within the communities. And you can see that looks at living as well as employment. So, and also then you see information on substance abuse and recovery. So this is a very large focus of activity. There has been a 15-member board seated to represent what's called the Northern Michigan Regional Entity. There are 3 board members from each of the 5 community mental health programs. Our representative on this is Randy Camps, who's a Grand Traverse resident appointed by this Board of Commissioners, who also is a tremendous asset to our organization. He has wonderful experience and is going to represent our interests tremendously well. The last documents in your packet look at the annual county commission survey that we do each year to help get evaluations of what we do well and what we don't do well and where we need to continue to focus on. You'll see the summary of the evaluation that was completed last year. It shows the questions, it shows by county, and it shows the number of respondents, and it also shows the comments that are made. This becomes part of our annual agency performance evaluation that we use to judge not only the performance of the agency, but my performance as the CEO of the organization. So the very last page in the document is the survey, and we are hopeful that whether tonight or at some point very soon, that each of you would take a few minutes to complete this. It's as important to us to know what you may not know if you're not aware of community mental health and the services that we provide, as well as what you know what we do. And we certainly want to know what you think we do well and what we don't do well. So we really would request that you would help us improve as an organization by sharing your thoughts. And You could give those to Charlie, or if you have those done, we can take them with us tonight. So that being said, Nicole, I don't know if you want to add anything from your perspective?
Nope, that sums it up. Thanks.
That sums it up?
All right. Do we have any questions? Commissioner Lemkool and then Commissioner Wheelock?
We're now into the technology stage for our Board of Commissioners, so we do not have a paper.
I see that.
So some of us don't anyway. So I think it's going to be one of those things, Jackie, maybe you can make sure that we get copies of this to those commissioners that have the electronic.
You should have copies of all that. We did send those to Chris,
Okay, well,
all the documents in advance. They should be in your
It's in the packet.
Right here, actually. We've got it in the packet.
it's in here.
Yeah.
I just don't know how to get it off here.
We'll help you.
I can certainly read the responses from the last survey. Whether or not I can figure out how to complete the new survey, that still remains to be seen.
That's right. I don't actually know how you would do that on an iPad either.
My, I guess, Greg, my concerns have to do with, you know, I'm still concerned as when I read down through here, even though Grand Traverse County is the largest contributor to your program, if I look at the scores from the different counties, your scores are the lowest in Grand Traverse County, and that concerns me. You know, and you and I have had multiple discussions about our need for mental health services in the jail. Because, you know, the sheriff's here, and I'm sure he and Captain Hall can talk to you regularly about the fact of the need that we have for mental health services in our jail. And, you know, I guess it just bothers me that when I look at all of the counties that participate, even though we are the largest and we pay the most money, our mental health scores are the lowest in Grand Traverse County of the 6, 7 participating counties. You know, and now if this thing gets involved into, you know, the whole northern part of Michigan, you know, are we going to get that much less service? You know, that concerns me. You know, I do realize that depending how NIMSAS ends up, we pay them a considerable amount of money a year also. So whether that benefits you, whether it doesn't benefit you, I don't know. It's going to depend on the services that they provide compared to, you know, what you're going to provide and how that's going to work out. But I've always had, you know, ongoing concerns about our mental health need in our jail, and we still are not meeting that need.
Anyone else? Commissioner Rennie?
Yeah, question here. Sonny makes a great point, but only 5 people submitted responses out of 9 or 11 or
That's
something.
not a good
So it's not a very good number.
5 out of 9.
Or whatever it
last
is.
year.
Okay, I would make a suggestion that we all fill them out this year.
Oh, absolutely.
I would like to get them over to Greg.
I'm pretty confident I've always filled mine out.
Dr. Lathrop?
Are they anonymous when we fill them out, or are our names on them?
I would imagine if you fill it out online and send it, your email will be attached.
But you can fill it out anonymously, print it off and fill it out and just get a written copy and it goes in.
Historically, they've been anonymous unless the person chooses to put their name on it and ask for some type of follow-up contact.
Okay, thank you.
Commissioner Lemkool?
I just want to commend you for bringing the Traverse Health Clinic into the health department. I advocated that for many years, and I just think that's long overdue, and we appreciate that. I think that's going to make a huge impact into our community. There's a lot of good things that are happening to mental health. I do think, I echo Sonny, as to, you know, the services for the people in Grand Traverse County is the one thing we have to work on. We understand the regionalization to be able to make sure that it happens, but we also want to make sure that this is the core. This is where the people came from when they closed the Traverse City State Hospital, and they stayed here. And they still need those services, and we need to be able to make sure that they get those. I don't know how many of those people are still left. You know, I don't know if you've done a survey from the people that were released from the hospital that are in our community and still continue to need services. I think it would be very beneficial to know those kind of numbers and what kind of dollars are needed for that, and how are our dollars working for mental health, because we are giving you a lot of money, not only with NIPSAS, but also from county appropriations. So I think it's really, that's one of the things, we really need that dialogue more than ever before, so that we can have that information coming back to us so we understand. Because we're going to get questions from our constituents. They're going to want to ask us what's going on. And we really do appreciate the board members, and, you know, I know Charlie went kicking and screaming onto the board, but
I love it now.
but, you know, every one of us that have been assigned to that board went kicking and screaming, and we all come out completely converted to the fact that mental health is doing a great services for our community. And we want to say thank you for you and your staff for all the good things that are happening, and the board as to how well they're working together.
Commissioner Wheelock.
I guess, you know, one thing that always bothers me is when we talk about our per capita for mental health in Grand Traverse County, everybody automatically says, well, it's because the state hospital was here. We're 3 generations past that, folks. You know, we are way past that. Why is our percentage so high? But I always come back to, we have the treatment facilities here. People come here for the treatment and they stay here. You know, and that's why we have them. I don't believe it is because that the regional, the psychiatric hospital was here. That we're generations past that. Most of the people that were housed at the state hospital have long since passed on. You know, there are a few. I'm just supposed to be there on a regular basis. But you know, I think the thing is that the reason our per capita is so high is the fact that we have the treatment facilities here. And in this region, and therefore the people come here and then they stay here. But you know, that's why our percentage per capita is so high.
All right, anyone else? Commissioner Reddy.
Getting back to Herb's comment, I was a little reluctant to go on that board because, like so many other people, when there's stuff out there you don't like, you look the other way. And you guys do a heck of a job over there.
Thank you so very much. And, you know, just to respond to Sonny, I have always appreciated your candidness. We get better with candidness. You know, we continue to work as hard as we can to better serve persons in the jail and work with law enforcement. So we don't take any of the comments as to be defensive. It gives us a challenge to keep doing better and to ensure that we can provide the best outcome for the tremendous support you provide us. So thank you so very much for allowing us to join on a very, very busy night.
All right, thank you.
Thank you.
Next on the agenda, Grand Traverse County Sheriff. Number 1, Fleet Vehicle Maintenance Contract.
Good evening.
Good evening.
Good evening. I'm Tom Bensley, Grand Traverse County Sheriff. Randy Fuelis. I'm the captain of the Road Patrol Division with the Sheriff's Department.
The captain is, you've received the information on our request for bids and the maintenance contract. The captain's here to answer any questions you might have. If you haven't had a chance to take a quick look at that, it's a 3-year proposal. We've been with a current provider for quite some time. There are, depending on how you look at it, some fairly close bids there. There was a little issue with the timeliness. I don't think that's a big concern with us if it's not with you. So we are here, specifically the captain, to answer any questions that you might have.
I have one.
Yes?
Well, I understand that D&W is your first choice. However, I have seen the county, I've seen the city of Traverse City reject bids simply because they missed the cutoff date. And I really do believe that the cutoff date is important. And if you miss it, I'm sorry. You're not in the mix. That's my own view. I don't know how other commissioners feel. So my question is, what's your second choice?
I think the undersheriff's memo indicates the TC Fleet Repair.
Okay.
Really, we've obviously been doing our oil changes at TC Fleet Repair over the past year, and they were the low oil change bid, so we were going to ask for recommendation to continue with TC Fleet Repair. We have not had any issues with them whatsoever in a negative light. We've been pleased with Mr. Grist and the services he's provided for us. And I think, again, our choice was basically either D&W or TC Fleet Repair. I don't know how much,
All right, well, I don't know how others feel, so Commissioner Rennie.
Were the bids open before you got back in touch or realized D&W wasn't there?
the undersheriff had 3 bids on his desk Monday morning when they were due. That did not include D&W Auto.
Right.
Apparently, the day before, Tuesday. So to answer your question, I don't know. I wouldn't speak for the undersheriff whether, I'm assuming that he opened the bids Monday morning and Tuesday. Do you know, Sheriff?
He indicated that the bid was not there.
Okay.
They apparently had sent faxes to other people. And when they contacted other people, they said, hey, we didn't get a fax from you.
This is D&W, you mean?
Yes, I'm sorry. We didn't get a fax from you.
Okay.
And so they started backtracking and said, who did we send faxes to? Apparently technology has failed, and we were one of those agencies or people that faxes were sent to by them. However, they didn't show up.
So were all the bids opened at the same time?
Yeah.
Okay.
Except that one.
Okay, so they were
didn't have
open
it.
prior to that one then?
Oh, yeah.
Okay, just wondered about that. I would say, I echo Chris, I don't know why it's here. I think you guys should make the decision. Myself,
They can't.
That would be
No,
my
no,
feeling.
That wasn't her opinion, but.
Anyone else?
So am I hearing a recommendation for TC Fleet Repair because you've been doing business with them for the last year or two?
Well, not specifically that, just indicating after looking at the bids, the way they came in, it kind of came down to either D&W or TC Fleet Repair. We've just been doing our oil changes at TC Fleet Repair, and that's been going very smoothly over the last year.
And the other repairs are going to D&W?
Yep, all of our major repairs go to D&W.
So, in TC Fleet Repair, do they do major repairs?
They do.
They do?
Yes.
Have you had experience with that? Any experience with that? Any repairs?
Some repairs there. I've had a couple minor things taken care of with my vehicle, and very helpful. And let's be honest, they like our business, and so when there are oil changes, they're falling all over us. Okay.
Right.
Would that continue if they got the vehicle maintenance contract? If they did, I sure hope so. But I think they're competent. Some people have some concerns about their size and their operation, which isn't as big. But they have another large customer. I think they do all charters vehicles. I think charter communications vehicles. So.
All right.
Comes down to
Commissioner
the
Wheelock.
bottom line.
Well, I probably already know the answer to part of this question, but that's not unusual when I ask it. We historically have used D&W exclusively for major type repairs for a long time. I can't help but notice in the bid packet, their price per hour is $9 per hour cheaper. But more importantly to me is their markup on the parts is 10% over cost compared to 30% over cost. When you're talking about a $1,800 transmission, that's a lot of money. And do you know approximately what we paid to D&W last year?
I do.
I'm sorry, I should have asked.
No, that's fine.
Or Randy,
I do have that. Looks like this would include Road Patrol, Marine Division, Administrative, and Detective Bureau. The total to D&W is $43,765.
So if a third of that is parts, we're still looking at a significant amount of money savings on that extra 20% on the markup on the parts.
Commissioner Rennie.
I'd like to ask our council if there's any issue with opening this bid after, or receiving a bid late and accepting it. How's that?
No, yes, certainly you want somebody to submit the bid on time, but you do have some discretion here. Whether you want to exercise the discretion is totally up to you.
Commissioner Lemkool.
Make a motion that we sign a contract with D&W Mechanical for repair and TC Fleet Repair for oil changes.
Is there support? Moved by Lemkool, supported by Wheelock. Roll call vote, Jackie, please.
That's what I was thinking.
Commissioner Rooney?
No.
Lemkool?
Yes.
Lathrop?
Yes.
Inman?
Yes.
Wheelock?
Yes, ma'am.
Thomas?
Yep.
Rooney? Oh, sorry, Chairman Maxbauer?
No. All right. Motion passes. Next, request to request bids for emergency response and recovery vehicle.
In November of 2009, we sent a letter to that time Chairman Thomas indicating that items that with the seizure money, what we kind of planned on doing with that. Several of the things have been accomplished from that letter. One was a new building for the Recreational Vehicle Division, tasers for all of our patrol officers, 3 years of paying for air cards for mobile data computers because of the reception and that we weren't getting with the radio system. We purchased laptop computers for the detectives. We made a contribution to the CA Child Advocacy Center. And one of the other items on there was a new dive van. We, at this time, have your information indicates that the balance in that seizure account is $167,000. Actually, in talking with Mr. Bott today, it's about $16,000 more than that. So it's somewhere around $173,000. Excuse me, $183,000. So at the end of last year, we submitted a 2% request to the Grand Traverse Band for $150,000 for this van, and that was not granted. At this time, we just want to move forward and go out for bids to get a very close price. We just got some estimates. We will also be requesting from the band a second try for the same thing. If that doesn't happen, then at some point in time, we would like to use those seizure funds to replace this van. Technically, we cannot replace it. We can't trade this in. We can't sell it because of the seizure fund rules. And so in the replacement of that, we are trying to figure out how we're going to reuse the current van. It may be a command center. We're putting some money in next year's budget to revamp that. It could be a R&R vehicle for officers on the scene of something. Most typically, when the dive team is in use someplace, so they have a place other than that to decompress, to rest before their next dive or operation, things of that nature. So we're not exactly sure what we're going to do, but if we buy a new one, we have to keep the old one, and we're trying to repurpose that.
Commissioner Wheelock.
Madam Chairman, I would make a motion to authorize the Sheriff's Department to seek bids to replace the existing dive van.
Second.
Or to purchase a new dive van.
Moved by Commissioner Wheelock, supported by Commissioner Thomas. Commissioner Wheelock.
Tom, one of the questions, the seizure fund, the ICE fund had a timeline that we had to expend that money. We got to be getting close.
Yeah, it's it initially was 3 years. I think they expanded that to 4 years, and we just kind of been holding off on this. We were hoping maybe somebody else would fund it.
Well, it took us quite a while to get the money after we supposedly were going to get it too. So there was no matter what the
Oh, sure. Was. There was a time. There was a delay there. because they had to dispose of the assets of that company, and, that took a time. So there will be some money left. We're trying to come up with, good uses for that money. But again, one of the things is this has to be something that we don't have, basically. We have to go, can't just replace cars or something. So that's kind of difficult.
Any further questions?
Real
Mr. Reddy.
quick, what kind of van is this for $140,000?
Very large. The current one is 30-some years old, 33 years old, and it's outgrown, or we've outgrown its capacity.
So this is a larger vehicle?
Yeah.
Okay.
A FedEx delivery van size.
Okay.
That's what we're looking at. That's basically what we need. Is we don't need anything real fancy. We need space to put a lot of gear in that van. So we're just looking for space, and those FedEx type UPS vans work the best. When you see the big ones, that's kind of what we're thinking.
So right now, your vehicle is a standard kind of van?
No, it's much larger. I think it's a
16-foot
or something like that. So we're looking at another 8-10 feet maybe. We just need space, more room inside for the gear, and this is stuff that typically needs to be warm. Plus, when you have 7 or 8 people trying to maneuver in there and change out equipment and that kind of thing, it gets a little crowded. So that's why we're thinking, at least at this point, just thinking about converting the other van to just some more space, so guys have more room, maybe to dry equipment out in there and get out of the way, sort of thing.
Over the years, I've had a few opportunities to try to get in there out of the weather and get warm a couple times, and it's pretty crowded with all the tanks and the equipment that's sitting around. If you get a half a dozen divers on scene and you're trying to deal with how many air bottles they have and regulators and wetsuits and gear, it gets real congested in there sometimes.
Well, it's just not a very fancy van, costs $141,000. That's interesting.
Well, the inside is designed and laid out for storage areas, not lockers, but closets and shelving and
it's a custom
drawers
interior, essentially.
Yeah, you can't drive down the road with compressed gas tanks flopping around. They need to be secured.
Yeah, it's not something we can just go purchase
Okay.
off the shelf.
Let's vote. All those in favor?
Aye.
Opposed, same. Motion carries.
Thank you.
Thank you for staying. Thank you for coming.
Thank you.
All right. Next on the agenda, Commission on Aging, Board Technology.
June 29.
We have
Georgia Durga, Grand Traverse County Commission on Aging Director.
I'm Karen Rennie, and I'm a board member of the Commission on Aging.
On your tabletop, we are following the county board's lead, hoping to get some technology for Commission on Aging board members. And the cost breakdown is on your tabletop. We found out that we will only need 12 tablets instead of 14, so the cost will go down a little bit because staff will be getting, we found out that word processing doesn't work too well on the tablets, so we're going to have to get notebooks, which we would get through our own budget anyways. So that will take 2 off the quantity and 2 off the Gmail addresses because we already have a Gmail address, the 2 staff people. So, and I broke down the cost by the one-time purchase of the technology, which I worked with Don Sheehan on. It would be exactly what you have, and we would get the same piece of technology for all of our board members, with the exception of Commissioner Maxbauer and Commissioner Inman, who already have them, so we would not be purchasing for them. And then I gave you a breakdown of 6-month service. That's what it would cost us this rest of this year, assuming that we start in June, and then a full annual cost of service for next year. And the service is a cellular service plus the Gmail address.
Commissioner Inman.
By the way, this did get approved as presented and recommended to the Board of Commissioners, as presented at the Commission on Aging meeting. Two remarks that I have on this, and these are remarks that I spoke on, is that I said, I think this kind of request needs to come to the Board of Commissioners because of the overall total dollar amount. But further, the board, as I indicated to the Commission on Aging, to my recollection, has really not set a guideline or a policy for other boards and commissions that we appoint to have this upgraded technology. And I know that the Board of Commissioners had asked staff to do an analysis of, are we saving costs by giving us this technology over a period of several years rather than postage and mailing and copying, those kinds of things. And so I asked Georgia if she had done an analysis that she had submitted to our county administrator showing that it would be a long-term savings, and she indicated that she had prepared some documentation for him. So that gives me a comfort level that that this would be an overall cost savings like it would for the Board of Commissioners. They've got, like, how many members? 13 members right now?
Well, we're down to 12 now.
12 members, and they have a regular meeting, and then each member, I think, belongs to one or two committees, so they might have like 3 meetings a month, and as similar to we would have 4. So I think unless Dave wishes to speak on this, it appears as though, as long as you can verify this, that there was an analysis done and that there appears to be a cost savings overall.
Over time, yes.
Over time.
Yeah, I mean, it's not a 1-year, payback, but over a period of 2 or 3 years, it's a savings.
Okay. And the second point was that I indicated that I would be recommending to the board that we take this item up at RMA, so we don't give the impression to other boards and commissions that we have on the whole list of them, that they just can come in and just get laptops. That, there has to be some guidance on our behalf that says, okay, based on the number of meetings and the amount of paperwork that's normally sent out and those kinds of things, does it make sense to do these tablets that we're going to get or have versus just sending out mailings and paper? If they meet once a month and they've got a small board, it may make sense just to continue to generate paper. So I'm going to put that on the agenda without any objection for RMA, that we can give some guidance to administration in terms of how we want to treat this moving forward with other requests coming in from boards and commissions that we point to.
One of the things that we did discuss at Commission on Aging when this was passed, that we would appreciate, if the board is supportive of our moving ahead with technology, we would appreciate it if we could make the motion effective immediately so that Georgia can direct staff to go buy the tablets.
Yeah, we talked about a ratification on the full board of commissioners for tonight's meeting.
Georgia, do you want to add anything, or Karen, would you like to add anything?
No, I think that it's time to go forward with this. I mean, evidence has shown that it'll be a cost savings. We have a large board. We have a lot of paper that's generated. It's a lot of time for Georgia's staff as well.
Yes, it is.
And so I think it's time to go forward with this.
Can I add, too, that we set aside funding many years ago in our a separate fund because we knew we wanted to move forward with technology. So we have those funds set aside for this, and then we also want to look at our in-home services, which is our software can't accommodate our needs any longer. It's way outdated. And so we had planned on doing this many years ago, but we've had other things that we've been working on that were more important. So we do have the money. It would not come out of the county general fund. It would come out of money that we set aside many years ago for this project.
Madam Chairman, I'll make a motion that we approve the request as presented by the Commission on Aging Board to purchase 12 iPads that would come out of the Commission on Aging budget.
Commissioner?
I'll second it.
All right.
To take immediate effect.
And this would be a ratification of the full Board of Commissioners.
All right. Yeah. Commissioner Wheelock.
I guess I don't have a big problem. The only question I had, is this purchase being handled through our IT department?
Oh, yes, definitely.
Oh, yes.
Yeah, well,
but it's a good question.
You said you wanted Georgia to go
I
go
did-
buy them, and
Thank
I want to
you.
make sure that
Thank you that
these
you're
are
not
being.
I'm not sending her to Best Buy tomorrow?
They're being purchased, they are being purchased and programmed through our IT
Yeah.
department.
Oh, yes.
In fact, all these numbers came from them, and he assured me that he would hope that we would purchase the same thing that you have so they don't have more learning curve.
All right. Any further discussion? All those in favor?
Aye.
Opposed, same. Motion carries.
Thank you.
Thank you. Next on the agenda, unfinished business, Commission on Aging Rules and Regulations ad hoc.
Can I address that, if I could?
You can address anything you'd like.
Yes. I would ask that this item be tabled. During the discussion at the Commission on Aging Board, we discussed both the rules and regulation document. We also discussed the bylaws. And there was some remarks and discussion for board members as well as staff that there needed to be some clarification on both documents. And that both documents, under certain categories like vacancies, weren't really tied together. They were kind of, we really need to make them consistent.
We need another meeting.
So it was recommended that we hold off on taking action on those two items, set up the ad hoc committee again to meet, go over the remarks that were made at the Commission on Aging and any other remarks that might be made, and then bring it back to the Board of Commissioners for approval.
Do we need to table this, or can we just take no action?
Why don't we just defer it to the ad hoc committee for recommendation, defer the recommendation.
All right. Commissioner Wheelock?
Well, I guess, at least from my perspective, I'd like to have some comments on this too.
Okay.
So is that this Board of Commissioner representatives can take that information back to the ad hoc committee also?
Okay, that'd be good.
Certainly.
Sure. And if we choose not to, not to take action on it tonight, that's fine. But I think, you said that the Commission on Aging had some issues with it. Well, I don't know about anybody else, but I have a lot of issues with it.
Okay.
So why don't you perhaps a motion to send it back to the ad hoc committee?
Why don't we do
to
that,
further
and then we'll have, I'll make a motion that we refer this item back to the ad hoc committee for further review and recommendation.
Support.
Moved by Inman, supported by Lemkool. All those in favor?
Aye.
Opposed, same.
Well, I'd like to have some discussion somewhere along here, and I don't know whether that
Well, why don't
discussion
we
should have been happened before we vote on this motion,
Why
or...
don't we invite you to the ad hoc?
No, I think that it would be important to have discussion amongst the commission.
I think we should have
Fine.
public discussion of this document, personally.
All right. Would you like to do it now?
Absolutely, I'm ready to do it now.
All right.
I think, I don't know how far back to get started here, back, this document basically takes a even less hands-on approach of oversight of the Commission on Aging. It truly does make an awful lot of what the Commission on Aging does hands-off by the Board of Commissioners. And I have a real problem with that. Over the past few years, we had issues with the Commission on Aging comes in with a grand garage to be built on Keystone Road. Commissioner Thomas and I got involved in that discussion, and the net result was if I recall, somewhere in the 20% savings of what the garage actually cost that we did. A year ago, Commission on Aging decided to raise the fees, shortly after a 86% voter approval of funding for the Commission on Aging. They come into us and they want to raise the fees charged to seniors. And the Board of Commissioners says absolutely not. Some of those fee increases were 300%, and the Board of Commissioners said no. They went back and reevaluated the fees that they were going to charge, and there was some increase, but it certainly was nothing near what we had. During the budget process, they chose not to fund Area Agency on Aging nor Meals on Wheels. The Board of Commissioners brought them back in and said, no, we need to continue to fund those programs. In January of this year, the Board of Commissioners decided that the County Board of Commissioners needed to have more to say about how the Commission on Aging did things, so we appointed a second county commissioner to that board. And yet now we're talking about passing
rules and regulations that gives the Board of Commissioners even less opportunity to have input on how they make decisions. And that's just simply not acceptable to me.
Sonny, could you indicate to me where you believe that is stated
Well,
at?
if you look at point 6, Commission, under number 6, it talks about the Commissioners, I got a whole bunch of notes
Where are you
here.
at now?
Board of Commissioners, under the general control of Grand Terrace County, maintains the right to direct and override all. The Commission on Aging needs to understand they are an advisory board to the Board of Commissioners.
We
They
do
are not a
understand
sole.
that.
Well, I know that, but that's not the way this document's written. And 6.4, they're asking us to give them the authority by which to purchase and acquire property. Under 6.6, it gives the Commission on Aging the ability to develop, administer, construct, reconstruct, or alter new or existing buildings. I'm not prepared to give that authority to the Commission on Aging.
Yeah, in our meeting, those were all subject to the Board of Commissioners' approval.
But that's not what it says in this
Yes,
document.
and that's why I'm saying that,
That's why we wanted to
that's
go
why I
back.
wanted to go back. There are a lot of
Under
adjustments that really needed
6.7,
to.
we give them the opportunity to accept gifts. Under 6.8, 6.9, we give them sole control over the property. I'm not giving an appointed board that's not responsive to, or is not elected by the electorate, the responsibility to develop and handle property.
You do the Parks and Rec Board.
No, they don't. They manage the property, but they can't buy property.
Yes, they can.
Well, Parks and Recreation Commission, as it is drawn, has some different authorities, and, Chris and us can get into that discussion.
Well, I'll be quiet.
It also gives them the sole discretion to set fees under 6.11. Under 6.12, it gives them the ability to adjust their staffing levels. All staffing levels have to be adjusted through the county's HR department, and with the approval of this board. They need, if you look at section number 9, the way it reads, it sounds like the Board of Commissioners is subordinate to the Commission on Aging, and that's not the way it is. I recently had opportunity within the last week and a half to have extensive discussion about 5 lawnmowers that were sold by the Commission on Aging to Padnos.
Sonny?
Yes.
I think that's being investigated
Well,
by
it is being
administra-
investigated,
by
but you know
administration.
what? It's public information, and the public needs to have the opportunity, and this is the only opportunity I'm going to have the discussion publicly. The Commission on Aging took 5 lawnmowers to Padnos, sold them for 9 cents a pound as scrap. 4 of those 5 lawnmowers were sold within a matter of a few days to landscapers in their area at a cost of $150 to $200 apiece. I know for a fact that one of them was sold online after spending maybe a half an hour's worth of time for $1,800 on Craigslist. The 2 that a young man that I know very, very well, because he happens to be my nephew, bought, they paid $140 for one and $186 for the other. They spent 20 minutes, and they're mowing lawns with them every day. One of them is a 2006 lawnmower with just barely 600 hours on it. That machine costs well over $6,000 to purchase new. Dustin tells me he could easily sell it on Craigslist for $3,500 tomorrow. How was it sold for 9 cents a pound? I don't believe that the Commission on Aging or anyone in their organization should have the ability to sell county-owned property for scrap without this Board of Commissioners declaring it to be scrap. The sheriff can pick up a bicycle or pick up evidence of a crime. He stores it in his evidence locker. He can't sell that at public auction, not sell it for scrap. He can't sell it at public auction without this Board of Commissioners approving every single item that he's going to sell. And I just simply find it totally unacceptable, and I've received at least 4 or 5 calls this week from citizens that want to know how their taxpayer money is being pissed away because they're taking county-owned property and selling it for scrap.
Hang on just a second. Georgia, would you describe the process for selling lawnmowers And clearly, something went awry here.
There's no doubt about that. I talked to Holly for probably 20 minutes this morning.
Yep. Well, we've actually spent quite a bit of time on this in the last 24 hours. Dave first made me aware of it, so I want to thank him. And I've been trying to keep him abreast of what's been happening. But the procedure is, and we followed it, is that when we have equipment when we're disposing of an asset, if it's under $5,000, it's put on a form. Form comes to me, the department head to sign, then it goes to the county administrator to sign. We followed all that process because all of them were purchased for under $5,000. Now, as you step down, I think some things below us were not done appropriately, and that's what we're looking at. So, and as far as we knew, well, let's just say that. And I can tell you that we've already started investigating. We have done quite a bit of investigating already, and we're going to continue until we find out what actually happened. I've actually talked to one of the people that purchased the mowers already, and we'll report back to you as soon as we get some answers.
Commissioner Inman.
Commissioner Wheelock, a lot of the things that you were indicating during your discussion on the summary of these rules were talked about at the Commission on Aging level, that we needed to change this because a lot of this stuff has to be reworded and changed subject to the Board of Commissioners approval. And that's and there's some other language changes that we needed to make. So and that's one of the reasons we wanted to get it. I would prefer that it had been off the agenda, to be honest with you. But now that it was presented in the packet and read it, I can understand how you can be concerned about a lot of stuff that was put in there. So, in any event, we're going to address it at the ad hoc committee level and try to clean up the language. I understand the direction in your thought, and it's simply the protocol and the practice that we've had all along. We just need to put it in writing. What we don't want to do is get into a situation where we are attempting to micromanage every decision that they make, and we need to give them some kind of guideline that says, these kind of things are fine, and these things, you really need to come back and get our approval on. I mean, that's the intent on this document. But the other one is the issue regarding why it didn't come here. It was just it was an oversight based on my discussion with the administrator. He's brand new. Not brand new, but he's been here not a long time, and he's not aware of every protocol that this board has for a number of years in terms of requirements, what we expect and what we don't expect. So, I just give him the token of the consideration of the, there are going to be some things that continue to pop up over time that we need to just bring him current on in terms of, how the process works and what we need to do in the future. So. But normally that document would have that form would have normally came to the administrator's office and then to us.
Is this the scrap form you're talking about?
Well, to dispose of county equipment.
In this case, though?
Yeah.
Yes.
Now.
Did you sign it, Dave?
Apparently I did.
Okay.
Apparently. So, we'll just, I'll just.
But that being said, they were told that the total value was less than $5,000.
But what I would, the only thing I brought up to Dave was on, if we just look at what processes, it seems to me that if Lawn, Lark, and Garden is the company that we expect to maintain our equipment with, it seems to me they ought to be making the determination whether it's scrap or it can be repaired or if it's got value or we keep it or whatever, and not just go directly to a scrap company and say, we want to dispose of this equipment because we think it's too old and it doesn't, we want to get some new stuff. So I think we really got to look. I think we got to look deep into the process and make sure we're doing things appropriately, and we've got maybe a reliable third party that we can rely on that says, this is the real condition of this equipment, and we're not disposing it for scrap.
Commissioner Rennie.
I wouldn't let the vendor make that decision because maybe he likes working on stuff, I think you need to look at it from a cost analysis standpoint. If it's costing a lot to repair the top,
I don't know.
Time to get rid of it.
Somebody's got to look at it, though.
I don't think it's a vendor.
Dr. Lathrop.
How was the decision made to scrap these? How does it currently happen?
Well,
That's the question.
That's what we're looking into, because my understanding and Holly's understanding is different than what happened this time. So, and we'd like to ask that you let us investigate with our staff, and we will get back with you, and we've already started the investigation, but we'd like to ask our staff people what happened and get the facts. And
what does the sheriff do? He
brings it to
faces
us.
these same things.
He brings it to us.
Yeah, but someone says to the sheriff, this piece of equipment needs to go. Someone makes that decision.
Right.
And then he brings it to us. I'm just asking, how does he do it?
I don't know. It's a good question. Hopefully it's
Danny Brown does it frequently as well.
Yeah.
Yeah, that's a good question. How do we evaluate vehicles?
Mr. Rennie?
I think we should let the Commission on Aging do their analysis and get back with us. There's a whole lot of implications here that could be going on. We're speculating, and I think we're wasting our time.
I agree.
All right.
Any more
Moving
comments on the rules, Commissioner Wheelock?
Not as long as we don't have to pass them tonight.
We're not passing them tonight.
Here we go.
By the way, I really
We are
appreciate
going
your
to have
analysis.
rules that you're going to like.
can I just add one thing? The Commission on Aging didn't write those rules. I don't know who did, but it wasn't us. We were just given them, just like you were given them. So it wasn't our document.
I'm assuming they came from the ad hoc committee made up of members of the Board of Commissioners and...
No, they were
and
originally, I thought they were originally drafted by Bob Cooney, and then we reviewed them, and then we sent them back for
Send them back
discussion.
They're going back. We've got that.
Yeah, we
got
wanted,
that down.
we wanted the
Unless you wanna
committee,
sit here all
we
night
wanted
and-
the Commission on Aging and the committee members to look at it,
Order
and then we were
breakfast
going to
in.
meet again. So it wasn't supposed to be on the agenda. I'm going back to work. So.
Are you? Oh, good. That'll be fun.
A lot of things happen in 24 hours.
So true.
Can I say something?
Certainly.
Since I'm a new board member, but since I've been on the board, I have observed Georgia and everybody there always mindful of the Board of Commissioners, over and over again. It comes up in every meeting I attend. And I have to say, Commissioner Wheelock, I'm a little disappointed that you won't let her at least get her investigation done before you made public comments. Because it's very hurtful, you know,
the public
she is
contacted-
very concerned about public scrutiny all the time, as we all are.
When the public contacted me, I promised them it was on the agenda. This was on the agenda to be voted on tonight. And I promised the public that this discussion would happen.
And it did.
And they could either be here, or they could watch it on TV or watch it online. And I was going to ensure that that discussion was going to be happening.
I have every confidence that Director Durga will get to the bottom of this.
All right.
Okey dokey.
Are we done on Commission on Aging? All right. Thank you very much. We have no new business. Second public comment.
Ralph Soffordini, 220 Huron Street. One of the things, and I guess I could play back the tapes from, back last April and go over some of the things, but I just couldn't sit back there and let one side of the story be told. If you remember, Commissioner Wheelock, the Commission on Aging was given a bill of $320,000 to be taken out of their budget in January. That was the first we knew about it. We were put into a position that we had to take $400,000 the next year out of it, and we had a contingency for the first. That's why we went through those processes in a short period of time to make the cuts that we did. We didn't want to do that, didn't like doing that, and understood who is the boss. I mean, it's never come to mind since I've been sitting on that board. I've never got the idea that the Commission on Aging is the boss, because although I've argued sometimes over some of the decisions you've made because it took so long, but when it got right down to it, we understand that we're an advisory committee. We understand we work for this commission. We understand that you get most of the heat. You know, we get a little bit of it, but you get most of the heat from the voters. You know, so that's always there. You know, and when we put the ad hoc committee together to go over these things, we're trying to come up with the documents, you know, that cover most things. This last situation, I just found about it this afternoon. You know, that's an unfortunate situation. It'll be investigated and be corrected. You know, that, because we don't want that going on, you know, that those kinds of things occur. We don't have a lot of money anyway, you know, and
And so we want to make sure that we do it as diligently as we possibly can. We're also there for the voters. We're also there for the people we serve, which happen to be the people that are seniors, that are on our programs. It's kind of like somebody said, well, financially you're doing a little bit better. We're going to go out 2%, I believe, this year in our taxes. We're going to get 2% more money. And the first thing they said was, why don't we reduce the fees? Well, our fees go from $1 or $1.15 up to $45, at the very top, and so we said, yeah, but which one of you want to be replaced? Because we have the programs, and as you well know, 2% doesn't cover the upgrade when it comes to the perks that we get for our employees, and of course the cost of the service that we provide. But I don't want you to ever have the idea, Sonny, that we don't think you're the boss. At least I do. I don't like it sometimes, but sometimes I didn't like it before when I had bosses. The only other thing I want to say is I'm glad we are going to computerization, because I know there's one other guy in government older than me that did it.
But he forgot his tonight.
All right. Any other public comment? All right. Commissioner committee reports. Notices and announcements. I would like to say, I would like to express my condolences to the Owen Williamson family. I called Administrator Benda today. I've bent Commissioner Inman's ear. I'm surprised it doesn't flap over. And I'm going to say this, well, I'll just say it. I think we need to mark it or close it, that swim area.
It's marked.
No, it's not marked, at least not in my opinion. But I won't get into that, but anyway, that's my notice and announcement. Anyone else?
How about a notice out there? No swimming unless there's a lifeguard.
It says there's no lifeguard.
I can tell you that that I've heard from some parks commissioners, and we are going to look at some safety
I'm
issues,
amazed.
ideas. And I would invite any of you, if any of you have any safety ideas, boy, I'm all ears. Commissioner Lemkool.
The one thing I see glaringly in our community is the lack of swimming lessons to our students in our community and swimming safety instruction on how to reach, throw, and go, or row. And, none of those things were followed in that particular situation. And we haven't done a good job in our community. We have water within 6 miles of anybody that lives in the state of Michigan. And yet in northern Michigan, I'm willing to bet there's 50% of the people that do not know how to swim.
It's actually a higher percentage than that.
Is that right?
Yes.
And I think that's the discussion that we need to figure out, is how do we provide more swimming instruction for the students in our community?
Well, I want you to know,
because we do not have swimming pools in our public education like that are done in a lot of counties in our southern state, and other communities have more swim programs than we ever are thinking about. And I would hope that the YMCA will help to be able to start to get that. I would hope that we start to open up swimming lessons for all kids in our community as part of our civic center.
And I'm not going to stop trying.
Well, I'm just saying that's the discussion we need to have more than closing something.
Dr. Lathrop.
I include in that CPR.
Yep.
If I don't know about that situation, but I know that minutes matter.
In every situation, it's something. Commissioner Thomas and Commissioner Rainey.
A long, long time ago, I used to teach swimming, and at the YMCA, and they did a good job then. They'll do a good job here now, and I saw statistics that in the age group that we're talking here, the kids, that it's around 30% that learns how to swim. And that's half of them live on a lake. That's awful.
Yep.
Yep. I don't know what we can, you can't force them to swim unless you throw them overboard, though.
We also have to realize what the significant cause here was hypothermia. Well, when that water's 40 degrees, there's a guy on the coast, from the Coast Guard on the TV the other night was talking about at 40-degree water, your life expectancy is 3 minutes.
Yep.
I guess I'd like to focus on how we can make it safer and better. Commissioner Rennie?
The signs I saw said swim at your own risk. On a temporary basis, why don't you put a sign down there, no swimming? And then go further, if you want to put a lifeguard there or whatever, do something like that. We could do something real quick.
Well, that's a
It's
good
very
idea.
close to the high school, and it's the proximity to that high school that is the problem, in my
Good
opinion.
idea.
So put a sign up there.
Well, I think it depends on our liability on that.
Dave?
I think we have a Parks and Recreation Board whose statutory responsibility is to make these decisions.
Yep.
And I think it really does need to be discussed by the Parks Board
It
before
will
we start throwing
Yeah,
our...
no.
Still a good idea, though.
I would put one down
I
there
gotta
tomorrow.
say,
It certainly
For
is
a
something that you
sign.
can provide input to.
One
I
other
think it's their-
question.
their
Chris,
call
do you
first.
think there's any legal liability down there under the
I'm not a lawyer.
current
Oh,
circumstances?
you're asking
The other
not
Chris.
me.
I'm sorry.
I was going to say, I'm not a lawyer.
I'm sorry, Mr. Chairman. Our legal counsel, Chris.
In a situation like this, the county should be entitled to governmental immunity. The county should be immune from suit. Now, there's always exceptions to that rule. I don't see an exception that would apply here, but plaintiffs' attorneys can get creative. But if you're asking me if a suit was filed and that suit was successful, I would say probably not. So liability is really not a concern.
It's public water.
It is public water, but without getting into a long, detailed legal discussion, I don't want to keep you here for any much longer, but governmental immunity, it's a pretty big, strong shield that protects counties, cities, villages from suits like this. And it takes a lot to pierce that shield.
What about the Cinch Park thing recently, the electrocution thing?
And what happened there, the
Should I
county
shoot
was
it out?
dismissed. The county was dismissed out of that
Was
lawsuit.
there any settlement at all there?
The city is still being sued.
Okay.
Okay, closed session?
No, ma'am.
Madam Chairman, I'll move for adjournment.
What?
Yes, you heard.
You gotta be kidding.
We got home already. Support.
All right, moved and supported. And I'm assuming everyone's going, yes.
You won't.
We stand adjourned then, huh?
Did it work for you?
Yeah, it did. Having fun